home. Don't focus on some of the people who will be putting more negative information out there. I do want to also say that this virus is leaving a lot of people with a lot of scars and hurt and pain, not just because they've gotten sick, but because they've lost financially, because they've experienced great isolation and anxiety through all of this. But there's probably no group that has been more affected than our healthcare providers and our elderly. They are certainly our most vulnerable populations, and their families have experienced great anxiety and grief as well. I bring this up because I understand how many of you are feeling who have family and loved ones in long-term care facilities. My mother, in fact, is in the Chamonix Manor and has been there for a number of years. She has reached a point where she can't communicate. So I can't console my mother. And I know that that is probably difficult for many of you who can speak to your loved ones and they're feeling anxiety and you can't be there to console them in person. I apologize and I'm sorry that you have to go through that. And I know that although I can't provide consolation to my mother, I would like to be able to lay my eyes on her and know that her welfare is okay. So I want to say to those of you who are in my shoes, we are in this together. We are trusting caretakers together. None of us expected that this was going to happen when we entrusted our parents' care to long-term care facilities. But I know in my heart that my mother is being cared for, as are your loved ones. And if you need to talk, if it would help to write to me, please email me, and I would love to talk to you about that. As my thoughts and prayers are with all of you, I will also hand this off to my colleagues. First, Commissioner Bob Harvey. Bob?
Thank you, Diana. Appreciate that. And obviously, we all echo your sentiments to all the people out there who are suffering, whether they've lost people, whether they are worried about their economic status and paying the rent, paying the mortgages, and putting food on the table, worried about their businesses and what's going to happen with them when all of this is over. It's certainly something we are very conscious of, and we're doing everything we can to work with state and federal agencies to make information available to you. And that's really what I wanted to share. The Bucks County website, buckscounty.org, does have a COVID page. And so sharing that COVID page does, or taking a look at that COVID page, it does have information about economic resources, links to different agencies that can provide information to you. There is a 1-800 number that you can call that will connect you. You'll get a menu that you can select whether you want to talk to the health department, whether you want to talk to somebody about economic resources and plans. And that would be that's really the best place to go. I did have a conversation with someone from U.S. Senator Bob Casey's office. His website also, which is casey.senate.gov, has a tremendous amount of information for not only for people who have lost their jobs, but for people who own businesses, small and medium-sized businesses, about the different loans that are available now through the federal government, about unemployment. I did hear just a little bit ago that the state unemployment agency is going to hopefully have tomorrow, it's supposed to be set up for tomorrow, a new form for people who typically were in the past were not able to get unemployment insurance. People in the gig economy, people who were self-employed, people of that nature typically could not file for unemployment. So the state had to develop an entirely new system for how to deal with those people. That is supposed to be up tomorrow. So if you're in that category and you're looking for ways to access those resources, that should be available to you. We are also very conscious of the fact that as the weather is getting nicer, of course, this was a pretty mild winter in general and early spring, but as the weather's gotten nicer, we know that people are itching to sort of take advantage of the good weather and go to parks. The county parks have been closed for a few weeks now. And that was partly done to make sure that we were keeping people safe, but also keeping our employees safe. The more people we have at the parks, the more county employees we have to have there as well. And so we do owe an obligation to those employees to keep them as safe as we can. But the commissioners have decided, in consultation with our General Services Director, that we will open up the Bucks County parks on Monday. We're reminding you, please, to be smart about using the parks, to maintain that social distancing from other people who are at the park, from the employees who are going to be there. Park rangers will be there to enforce that social distancing and making sure that we are people that are riding bikes or walking or hiking or taking the dog for a walk is fine. Obviously, we're not going to be allowing people to be congregating in big numbers, so we are going to be they are going to be open for people, but we are asking you to be very conscious of being safe. And I just want to close by letting people know that you'll hear from Dr. Damsker in a little bit, and from Director Forrester as well, and they'll tell you that certainly we feel like there has been a little bit of a plateau in terms of the cases that we're seeing. So we're seeing a glimmer of hope, but again, I've used this metaphor before. If this is a sporting event, we're only probably at halftime right now. This is not the end of the game. This is not the 2-minute warning before the gun goes off. The fat lady's not singing. So let's all be very conscious of the fact that we have to keep social distancing, and we have to be smart about preventing other people from getting this disease in addition to getting it yourself. So thank everybody for everything they're doing to help, and our thoughts and prayers are with everybody as they go through this time period. And now I'll turn it over to Commissioner DiGirolamo.
Yeah, thank you, Bob. And just a few quick points. And I continue to be amazed and very proud of the residents here in Bucks County for all of them following the kind of rules and regulations that have been put out there about the social distancing and staying at home. And I continue to believe that staying at home and not going out unless you absolutely have to, whether it's for work or for shopping at a drugstore, is the most important thing we can continue to do right now. And also, if we're looking for heroes, I mean, there's a lot of heroes in this virus, but certainly, as Commissioner Marseglia said, our healthcare workers, whether they're nurses, they're doctors, or wherever they work in the field of healthcare, especially those who are working in our hospitals and our nursing homes, we should really thank them from the bottom of our hearts for the good work that they're doing. And I know firsthand, because I have a daughter who works at one of our local hospitals. She works a shift in the ICU division, and she's concerned about going to work, and I think probably a little bit scared. But she, like many other healthcares, and I think most of them, if not all of them, are continuing to go into work every day, and they're facing those dangers that this virus brings. So I think we all owe them a debt of gratitude. And just finally, an issue I think that's important to all the families here in Bucks County, and that is addiction. And the problem of addiction has not certainly gone away because of the coronavirus. It's still out there, and many families are struggling with loved ones who need help. And I think there's a big concern, especially because the state stores are closed, and those people who have alcohol abuse addiction, some of them might be really struggling with detoxing. And I just want to let everybody know that there is help available. And we have a Drug and Alcohol Commission here in Bucks County under the head of Diane Rossetti, and they're all doing an amazing job. There is help available. There are funds if you don't have insurance, and this is an important message to get out. If you don't have insurance, there are funds available that will help pay for your treatment. And there's a phone number that you can call that you can get the commission, and that phone number is 215-444-2700. So please, if you're looking for help, please call that number, and help is available. So that's like to say, and thank you. I'll turn it back to Diane.
Thanks, Gene. Thanks, Bob. What Gene's message is critically important. Please call if you need help. And just to follow up to Bob, you guys have been very patient with us having the parks closed. So now that they're open, I'm going to ask for just a little more patience. If you happen to live in a neighborhood where you can walk, or near a shopping center where you can walk, or you have a yard, maybe give that park space to people who are living in apartments and condos and whatnot, who really don't have access to getting out. Let them have first dibs on our parks. So thank you, and we will open it up to questions. Again, we have Dr. Damsker here, Scott Forster is here from Emergency Management, and Bob and Jean and I are here. Any questions, Larry?
Sure. The first question I have is from Marion Callahan of the Intelligencer and the Courier Times, and she asks, I know there is no firm date on reopening businesses, but can you give us a sense of what the rollout might look like, or any plans that are in place? Will it be in phases with some businesses or parks or places opening up first and then others that require more contact, such as salons, spas next? What will this look like?
Just wondering if, Bob, do you want to start on that?
Yeah, the 5 counties, Philadelphia and the 4 collar counties around Philadelphia, we have regular calls noon every day to discuss different ideas and options and what we're going through as leaders of the different governments in the southeastern part of Pennsylvania. And the subject of opening up and starting to plan for the opening up of the economy has come up. We are waiting. Philadelphia is developing sort of an outline that they are going to be sharing for input from the 4 surrounding counties, so that we want to take, we've talked a lot about taking a regional approach to opening up southeastern Pennsylvania. So that is something that we've started to look at. We're going to be continuing that over the next week. So as of now, we don't have a set date for when a plan will become available, but it is certainly something that we are beginning the process of developing that plan.
Actually, we were talking with Dr. Damsker, and I don't want to put words in his mouth this morning, but we did ask him a little bit about that. And we talked about the idea that the businesses you bring back, first, it may have to do with if we can control interaction with the public, if they have personal protective equipment, if they have a way to be able to manage employees and keep their employees and the public safe. So that'll certainly factor into that. Jean, anybody else want to say anything?
No, I think you've covered it pretty well. I mean, I just think also remember per the governor's directive that anybody who was going out and into a store now, he's saying that you must wear a mask as well as the employees. I think people need to be aware of that also, and I think that's a really, really good idea. So if you're going to the supermarket or the drugstore or anywhere else where there's people, that please wear a mask. It's very, very helpful.
Thank you. Another question, Larry?
This one comes from Jim McGinnis of the Courier Times. He did have a question about parks. I think that you've covered most of it, but he also asks if the county is aware of any areas where people are going and not social distancing, and if so, what steps is the county taking to keep people from congregating in public parks, public areas? I think you've dealt with some of this, but if there's anything else that you wanted to say.
I think that I see people that aren't social distancing. I'm still seeing people going. I keep saying this all the time. I'm like a broken record, but people are still going to food stores and pharmacies with their children. They're still going with partners. It really should be a single person trip into those stores. So I'm not sure why people keep doing that, but that is still going on. We have periodically gotten emails from people who have, been in the state parks or been somewhere and told us that people are still congregating. A lot of times it's younger people. So, I know there's a bit of invincibility there when you're a teenager. So it could be that. Anybody else want to address that?
Okay. Another question from Jim McGinnis, and that is probably for Dr. Damsker. We've seen some positive reports that while the numbers of cases and deaths continues to climb, the growth is not exponential. Are you worried about complacency? Are you worried that people will not take this as seriously or may stop taking protective measures?
Yeah, the overall numbers of cases that we're seeing on a daily basis, those do seem to be overall going down. Yesterday we had in the 50s. Today it looks like we have the 60s. Of course, that may go up, but those are from large testing. From certain facilities have done large testing. So yes, the numbers of cases seem to be leveling out. The number of deaths will probably be going up over the next few days anyway, because of the cases in long-term care facilities. I don't think that people are getting complacent. I think people are sort of getting used to the idea of social distancing and wearing masks out in public. I think people are taking it very seriously, more so than they were a month ago for sure. And I think we want to continue to encourage those things that the commissioners have all said earlier in this press conference. And I think that any talk of people wanting to reopen businesses and restarting the economy, those conversations need to be had, but they also have to be had with that same lens that if we do open businesses up, we may have to get used to the idea that we'll be wearing masks for months to come, keeping those social distancing for months to come. Even if we open up certain things, we're not going to stop with the hand washing and masks and everything else. We have to get used to that idea. And I think people are slowly becoming accustomed to that. I don't think it's complacency. I think it's just a little bit of people getting antsy. You know, they're being in their homes for many weeks. They may own a business that's not making any money. So I think it's more along the lines of people getting antsy to get back out. But I do think people understand the seriousness of this, and we're going to continue to make sure that people don't forget the seriousness of it.
Can I jump in there too? I just want to add to what Dr. Damsker is saying. I'm not as afraid of complacency right now as I am of people getting a hold of information on the web or from, you know, not very reliable media sources that start to suggest that we shouldn't be doing this anymore, that we'd actually maybe be more protected if we went out there and faced the virus head on. As I said in the beginning, trust Dr. Damsker, trust our Director of Emergency Management, trust us. We will give you facts on that. I just needed to add that.
Okay. I have a few questions from Aaron McCarthy of the Philadelphia Inquirer, the first of which is, how many nursing home patients and staff in Bucks County have tested positive, are under investigation, or have died of the virus? Have any particular facilities seen severe outbreaks?
Yeah, we've had 60 plus deaths in Bucks County, and probably a few less than half of them have been related to long-term care facilities. You know, knock on wood, we have not had any deaths of employees of those facilities. I think it's just really important to note that, though, these are the most fragile patients that you can have in our entire society. We have had a few situations in centers that have outbreaks. It's not just related to Bucks County. Many outbreaks are going on throughout the state, throughout the country. And once it's in these facilities, it's difficult to stop it. You know, we're doing our best. We're advising all of these facilities on how they can maintain the numbers of cases to minimize them. But there have been cases of deaths in these facilities. There will continue to be cases of deaths because of the population. But I want to say once again that we're not seeing a lot of cases outside of these facilities anymore. And I think that's really important for the public to hear. And it shows to the good effectiveness of the social distancing and everything else that we're doing. So I don't want people to be scared. I don't want people to say, oh my God, there's 5 additional deaths today. I want them to realize that while we feel horribly for those families, that if you look at it from a 30,000 foot view, these deaths are not occurring in the general public for the most part. And that's a good positive sign, and people are not getting infected from being out in public for the most part. So again, these are positive trends that we're looking at. But again, there are outbreaks in several facilities. We have over 30 facilities in Bucks County. So it's a problem we're dealing with, and we're in contact with each one of those facilities.
Dr. Damsker, to add in that, there was some, I guess, words out there yesterday I saw saying that all facilities should be telling us how many cases they have. And actually that should be made public to the press. In reality, if you have a family member in one of those facilities, or you're the POA for that person, you could probably get that information by calling the facility. I'm not exactly sure what value that is to, you know, that kind of information being in newspapers, because if your family member's there, you can get that information. Am I correct on that?
Yes, Commissioner, that's exactly right. You know, if you have a family member in a facility, if you're the power of attorney for that patient, that resident, you can call, ask for the administrator, ask for the director of nursing, and you can get really good clinical information on what they're doing for your family member, as well as if there's other cases in the facility, or whether there's maybe a few employees have tested positive. We do know that for the most part, the employees are the ones who brought these into facilities, not maliciously, not purposely, but they may have had very, very minor symptoms and not have known. But yeah, we don't see the public health value of the general public knowing what's going on individually in every facility But as you said, you do have the right to call as a family member, as the power of attorney, to get the information. And I believe that this facility should be providing you that information. So thank you.
Okay, along the same lines, also from Aaron McCarthy, a Montgomery County senior living facility was evacuated yesterday after more than 24 staff members got sick and patients were moved to another facility. Have any nursing home or long-term care residents needed to be moved in Bucks County? If not, do you have plans in place if a facility were to need to do this in response to an outbreak? Are any other additional resources coming to assist these homes?
Do we want to have Scott chime in on that first and then Dr. Damsker? Is Scott Forster on?
Morning.
Good morning.
Yeah, we are in close contact with the nursing homes and the long-term care facilities. What's important is that we want to make sure that the residents are protected, and we want to make sure that the staff is protected. We have provided them with lots of personal protective equipment, and we work with them, and so does the health department, in providing them guidance of isolation of the patients that are positive and moving them to different wings and different areas of the building. At this point, no long-term care facility has been evacuated in the county. We have not talked to any about doing that because we believe that moving the patients out of those facilities into an area where maybe they won't get as good of care, and maybe there is not a staff to patient ratio, and not being in a normal care facility may be even more detrimental to them. So what's most important is that we take care of the residents, and we take care of providing personal protective equipment to those brave healthcare workers so that they can stay there on site and provide those kinds of services to the staff.
Dr. Damsker, anything you want to add?
Yeah, and we have the ability, if you have a specific wing in a facility that has, let's say, 10 coronavirus positive patients, and you have staff that are either recovering or close to recovery, those staff could actually work in that wing because there's no risk of anybody getting infected. Everyone's kind of infected. So there's ways we can release people early from isolation. And there's things that we could do if necessary in urgent situations to make sure that there's coverage. So as Scott said, we're working with them. We haven't had the request yet. And if we do, we'll continue to talk that through. But moving people is the last resort.
Thank you. Larry?
Also from the Inquirer, when the mandate regarding universal masking in stores goes into effect, how will that be enforced in Bucks County? Do you have a sense of how many people are already following the governor's recommendation to wear masks in crowds and inside essential businesses?
Scott, have you talked about that down at the EOC or with our police officers and have any feedback you want to give on that?
Just this morning, we shared the directive from Dr. Levine with the law enforcement organizations. So we have not had too much conversation about that yet, but we do know that there's a lot of people out there in the public who are already self-policing themselves, ensuring that they are protecting themselves from getting the virus and others. So I don't think that it's going to be a situation where people are not going to understand, because as the commissioners mentioned before on this call and Dr. Damsker mentioned before, people do see the seriousness of this incident that's going on, and they want to protect themselves and they don't want to bring something home to their families. So I think that it will be much easier to get the general public to comply with this than you think it will be.
Okay, last question from the Inquirer. The county reports 30 adult ICU beds, 183 medical surgical beds, and 117 ventilators available at this time, according to the state dashboard. Where do you see the area hospitals in terms of an apex, and do you foresee having enough resources?
Dr. Damsker, you want to start?
Yeah, the hospitals as of now are able to handle the volume that they have coming in. It's been said before that the hospitals overall have much lower volume than they do normally for other things. And the volume that they are handling is mostly COVID related. People are not using the emergency rooms for primary care and some of the other things that traditionally people have done. The ventilator amounts are certainly there. The ICU beds are there for right now. My biggest concern, of course, is the cases in the nursing homes that may be getting sicker and may have to go to the hospital. That's sort of the only surge that we see at this point. I don't see a surge from the general community. I see any surge that will happen will be from long-term care facilities that have sick patients. Right now, the hospitals do have a handle on things. We know that there's a reserve of ventilators that are available. Some of them have opened up the COVID wings that are just specifically for COVID patients, and they do have some excess space that they could bring. They could extend their ICUs into additional beds. So the hospitals are working really hard. We've done a lot of planning with them, and they've done a terrific job making sure that they do have the additional capacity if necessary.
Thanks.
Okay,
Anybody
question
else?
from Samantha Bambino of the Lower Bucks Times. Are there patients at the Newtown Sports Training Center yet? Can you provide an update on what's going on there?
Sure. The Newtown Athletic Club is set up. It's ready to be used if need be. At this point, there are no patients there. As we heard from Dr. Damsker, there are plenty of hospital bed availability here in the county. We have 380 medical surgical beds available, 43 ICU beds available. And with community spread numbers down, we do have a lot of bed availability here in the county, and the NAC is ready if it's needed. But at this point, things look pretty good in the way of the hospitals being able to handle their incoming patients.
Okay, a couple questions from Tom Sofield of Levittown Now. He asks, has the county or county emergency services had to assist communal living centers with handling patients outside of offering advice and guidance? And for Dr. Damsker, what are the trends you're seeing with case growth via community spread and also among healthcare emergency service workers? I think you've covered the healthcare end of it, but maybe emergency services workers as well.
So the emergency services has supported the long-term care facilities and the healthcare facilities by providing personal protective equipment. Naturally, local ambulance services have responded to transport patients out. We do check on their resource availability. We do communicate with the local municipalities about things that the long-term care facilities may need. To ensure they have enough oxygen on hand, to ensure that they have enough PPE, that there is enough staff at the facility. So we do have those general conversations, but outside of providing PPE and outside of just monitoring their situation, providing them some guidance on different things, we have not had to engage in having a large presence of emergency services at the facilities.
And with respect to first responders, there have been a smattering of first responders that have been positive. I think the EMS and paramedics have done a terrific job making sure they're protecting themselves as much as possible, treating all of the patients with respiratory symptoms like they have COVID, whether they know that or not. And I think they've done a terrific job. So, a shout out to them working in a difficult environment. Same thing with police officers. We've had a few police officers test positive, but it has not been a large number. I think there's been a smattering here and there. And again, I would just say the first responders in general, whether it's police, fire, EMS, they've done a terrific job. They have to be out there no matter what. And I want to just make sure everyone's aware that, they are also risking themselves every day. And the ones that have been positive I've talked to many of them. They are excited to get back to work, and I want to give them, they're being very professional, and they can't wait to protect the public. So we have had some, but not huge amounts. The larger amounts have been more along the lines of healthcare providers in facilities, hospitals, physical therapists, people that are dealing face-to-face with people all day long. Those people, we've had a few more cases. We've also had some cases in people who work at the large, box store type places here and there because they just happen to be in a very high risk area. And those people, I want to give them credit for continuing to go to work and working hard and making sure that we have the goods and services that we need that are essential to get through this together.
A quick question again about parks. This is from Doug Gross of Patch. I know there was originally an effort to keep county parks open even after state parks were closed. Do you know the date when they shut down the county parks? And perhaps you can talk a little bit about that decision.
Geez, I feel like we've been doing this for so long that I can't remember one of the dates. So maybe Bob or Jean will remember in just a second. You know, I really don't think this is a good idea necessarily to open the parks. There has been a great outcry for us to do so, and taxpayers do fund those parks. So we are sort of letting the taxpayers make the decision on their own to go into them. I'm not. I believe that part of maintaining that social distance is not going into those parks right now. I do understand that there are people who live in places where they don't have access to open air. So I appreciate that they do need to use those parks particularly. But that's sort of my feeling on it. I would still encourage people to stay home, stay in your neighborhood. Bob or Jean, and do you remember the date?
No, I don't. I don't remember the date off the top of my head.
I don't either. I mean, I know it was sometime in March here, probably from about the middle of March to the end of March, somewhere in there. But I do believe from the question that the state parks are closed. My belief is that our state parks have been open. I know the Chamonix State Park, which is along the Delaware River in Bensalem, has remained open. So I do believe that the state parks here in Pennsylvania have remained open. I know New Jersey state parks have closed, but the state parks in Pennsylvania have remained open.
Yeah, I think the governor did close the state parks briefly and for a few days, then opened them. I want to say that we closed our state parks when Governor Wolf, ordered that Bucks County be one of the counties shut down. I think that's when we did it.
Okay. Last question that I have is from Jim Melwart of KYW, and I think you've touched on some of this, but in Dr. Damsker's opinion, understanding regional discussions are underway. What do you think needs to happen before we can begin to roll back social distancing and stay-at-home orders?
I think what we need to see is additional testing available, so we can jump on cases very quickly. It was difficult to do this early on because our testing capability was so restricted. You had to have a fever and a shortness of breath. And we've discovered clearly in all of our investigations that a lot of people don't even have a fever ever, or minimal fever. They don't ever have shortness of breath. They have other symptoms. And so I think now that we know more about the disease and what symptoms people have, we can get quicker testing, and we can do better contact tracing and isolate those people. So I think that combined with smart opening, we have to start planning for this now. Like I said, people, eventually we all know that no matter what happens, we can't keep the economy shut down for months and months at a time. So if we do this in a stepwise manner, while we open things up, make sure people continue doing social distancing, wearing masks, businesses keeping people apart, all those things, in addition to quicker testing, better contact tracing, and isolating hotspots, I think we'll be able to move forward when we have those two things together.
Okay, and I missed one question. This is from Awona Moqueen of Fox 29 News, and this is for Commissioner DiGirolamo. Can you give a little bit more detail on the help available to those with alcohol addiction? Is it just for alcohol addiction? What happens when they call the number, and are they placed at a facility?
That's a really good question. It is certainly first not just for alcohol addiction, but I say this all the time: alcohol is still the #1 abused drug. So whether someone has a problem with opiates, heroin, methamphetamine, the number I gave you, which is 215-444-2700, is the number to call with anybody that is suffering from any kind of addiction. And when you call that number, you will talk to a person who is working at our commission, Bucks County Commission on Drug and Alcohol. They will ask you some questions, And then at that point in time, always how are you going to pay for this? Your treatment is always a big question and a big problem. So if you have insurance, certainly that takes away that problem most of the time. If you do not have insurance and you cannot afford to pay for it yourself, then that's where the commission jumps in and helps you, whether it's try to find out whether you qualify for Medicaid, and they will help you take you through the process of signing up to see if you qualify for Medicaid. And if you do not qualify, then there are funds available through the county. The county has what they call an SCA, a single county authority, who administers the money that comes from the state and the federal government to help people get into treatment that do not have insurance or do not qualify for Medicaid. So the commission will hook you up with a treatment facility. At that point in time, they will assess you for what kind of treatment you need, whether it be inpatient or outpatient. And I would say most every time you're going to get the help you need, whether you have insurance or don't have insurance. So the first step you have to take is call that number and talk to one of the workers, the social workers at our commission, of Bucks County Commission of Drug and Alcohol. And that will start the process of very quickly getting you into the treatment that you need, whether you can afford to pay for it or not.
Thanks, Gene. And as we know, addictions continued through this virus, but treatment has continued through this virus too. And all the 12-step meetings have kind of gone virtual, and we've left those phone numbers and whatnot on our website too. Any other questions, Lara?
No more questions, but I do have the magic number in terms of when our parks closed, and that was March 24th, thanks to a member of my staff for emailing that. I'll kick it back to you, Commissioner.
Thank you. Any closing remarks? Commissioner DiGirolamo, Commissioner Harvey? Mr. DiGirolamo, do you want to go first?
Yeah. I mean, just continue to do what we've been doing to the residents of Bucks County, and and again, we talked about heroes and Scott from the emergency management group and Dr. Damsker from our health department. You just deserve all the credit in the world for the work that you're doing, the hours that you're putting in. And just to let everybody know, it's 24/7 around here. So we're working 7 days a week, and phone calls and emails do not stop at 5 o'clock at night. They're going to 10, 11 o'clock at night, and even sometimes after that. So we're doing everything we can to try to manage this.
Thanks, Bob.
Yeah, thank you. I want to echo a little bit of what Commissioner DiGirolamo said. We're talking a lot of questions today about nursing homes and hospitals and first responders and our communications with them. And I just want to make sure people understand that those communications started even before our first cases. Director Forrester and Dr. Damsker were in pretty regular consultation with the superintendents of the school districts, with the hospitals, with the nursing homes, with emergency management coordinators all over the county. And so the discussions that you heard us talk about today with long-term care facilities, those discussions didn't just start in the past few days. They've been ongoing for well over a month, even more than that, to prepare for this. And so I want to thank them for all that work that people never really get a chance to see that, and they hear about it in conferences like this. But I want to make sure that people understand those consultations have been happening, not just between themselves, but with their staff members and the staffs of all those other facilities and local governments. I also did want to give Director Forrester a chance to talk a little bit about one other aspect of what emergency management's doing. It's not just providing PPE and consultation and setting up the NAC, but also it's having a pretty big role in terms of food distribution. With so many people out of work, with our schools closed, and so many of the school children in Bucks County rely on their schools to get balanced meals. In some cases, it's the only balanced meals they get is when they're in school. A lot of meal programs have had to be really ramped up. And I want to let Scott talk a little bit about what's been happening there over the past few weeks.
Thanks, Commissioner. You're so right. You know, the commissioners and I and Dr. Damsker, we've had so many conversations about taking care of the needs of the people of the county, not just their medical needs and the heroes that go out to take care of the, you know, the folks when they're sick and all, but every day people have needs to provide for their family in the way of food and other types of services. We have coordinated a county-wide food distribution that not only involves the school districts, but the area agency on aging for the seniors. We've worked with Bucks County Opportunity Council with supporting the food pantries and the Fresh Connect. You know, in the county, we're giving 10,000 meals a day to not only children who receive free and reduced lunch program and folks that are, you know, struggling. But think about all of the people that are out of work right now and all of the folks that we are helping to put a good meal on their table to support their family. It's a lot of work. We've engaged the Civil Air Patrol from the state. They actually have been helping us go to Philadelphia with a refrigerated truck, pick up food, bring it back, distribute it to the locations where it needs to go. They're packing boxes with the local volunteers and the local school staff, handing it out. And, you know, we're trying to do what's right for the people who have that need every day. So we do want to support the needs of the children and their families and people who just need a little extra help right now as we go through this. It's not, you're right, it's not just about the health care that's being provided, but just taking care of people in general.
And if I can just, thank you, Scott, if I can just sort of wrap that up. And certainly for many people out there who are struggling, you're looking for places to go to get that help. The Bucks County Opportunity Council is a key player in that. And certainly you can get information about them on the web. They have their own webpage, but certainly through the county as well, county webpage. But for those who may be in a better situation financially, if you're able to help, you know, certainly you can look to make donations, whether it's food or whether it's money. You can donate time as well. One of the reasons we had to call in the Civil Air Patrol is because some of these food pantries were seeing a shortage of volunteers. And so if you're able to do that, that's certainly something that we really need right now as well. So thank you.
Thanks, everybody. Just to close, it's funny, as we've been doing this press conference, I got 2 texts from people who just received a positive test that they just found out they have the COVID-19 virus. One is a healthcare worker, one is another essential service. And I bring that up just to say, so it's still out there. We are making progress, but there are still people at risk. Someone had asked earlier about how we were going to enforce the mask thing. And I was thinking, geez, a month ago, I went into the food store and I almost laughed when I saw 2 people with a mask. Now I wouldn't dare go in there without a mask. So we are policing ourselves, right? It's really become that way. And I want to thank the residents for doing that, for stepping up to protect the people who are out there. We will be back Monday with the town hall, answer any questions residents have. That'll be at 10 a.m., same place, same time. And you can take a look at the website. We are trying to be as transparent as possible and put all of our meetings and whatnot up there so that you can stay in touch with your county. So take care. Thank you, everybody.
Thank you.
Thank you.